Good afternoon, everyone. My name is Elizabeth McElwain. I am the Director of Infection Control, and today we will be discussing dengue fever. Dengue fever is a vector-borne disease that is transmitted through mosquitoes to humans. It is most commonly found in the Southern Hemisphere in tropical locations like the Caribbean, Central and South America, Southeast Asia, and the Pacific Islands. Nearly 4 billion people live in areas with risks of dengue, and approximately 4 million people develop dengue every year. Symptoms of dengue can include nausea, vomiting, rash, aches, pains. And then severe dengue can include severe abdominal pain and tenderness, persistent vomiting, fluid accumulations on the lungs, on the liver, mucosal bleeding, lethargy, restlessness, and liver enlargement. The incubation period in an adult human is approximately 3 to 14 days before symptom onset. In mosquitoes, their incubation period is generally between 8 and 12 days before the virus replicates enough to transmit dengue to a human. There's several testing options available for individuals. The most preferred testing method is the nucleic acid amplification test, which is obtained less than 7 days after symptom onset. For individuals who have symptoms for longer than 7 days, they can pursue serologic testing, which tests the IgM antibodies. Um, and then for individuals who have been previously vaccinated against other flaviviruses like yellow fever and Japanese encephalitis, serologic testing can actually yield false positive results in that population. So cross-reactive flavivirus testing is done in those circumstances. Dengue diagnostic testing is available all over the country, all over the world, from several different laboratories, state and local public health laboratories, and the CDC. Individuals most at risk for severe dengue include pregnant women, infants, the elderly, those individuals in lower socioeconomic standings, and people with conditions like diabetes and renal failure. Individuals in these classes can oftentimes end up needing inpatient medical care. Control of dengue ranges. So people should always be encouraged to wear long clothing, keep their homes clean, get rid of any mosquito habitats that exist. And then nationwide, there's integrated mosquito management, which helps to try to control mosquito populations before they're able to spread the virus. There's also the ARBO-Net, which is a surveillance system that's passive. It depends on medical clinicians. Giving the diagnosis of dengue, confirming it with the laboratory, and then reporting it to public health authorities. Disinsection is when they spray for mosquitoes on ships that enter the US from areas with large amounts of dengue. And mosquito surveillance software tracks the number of positive mosquito pools over a defined time period and area. Finally, prevention is key, especially here in America. We encourage everybody to vaccinate their children, especially children who have tested positive for dengue in the past. The second case of dengue is oftentimes much more severe than the first. So it's always encouraged that children become vaccinated. It's been a pleasure having you all today.